Assalamualaikum and hi, this is Teacher Intan. Today I will present about seizure disorder and epilepsy in learning. Firstly, let us learn about what is seizure and epilepsy. Seizures are sudden bursts of abnormal electrical activity in the brain that can cause changes in behavior, movement, sensation or consciousness. Our brain normally brain cells communicate with each other using electrical signals. When there's a disruption in this communication, it can lead to a seizure. As for epilepsy is a condition where a person's brain has a burst of abnormal electrical activity and causing seizure. Epilepsy can affect people of all ages and background. It can be caused by various factors including genetic predisposition, brain injury, infection, or developmental disorder. There are two types of seizure. Firstly, we go through generalized seizures. Generalized seizures affect the whole brain. There are few types. First is tonic-clonic seizures. These are what most people think about when they hear seizures. They involve loss of consciousness, stiffening, and followed by jerking movement. Second is absence seizure. This causes a brief loss of consciousness and often mistaken for daydreaming. The person that is experiencing this may stare blankly and might not remember what happened during the seizure. Third is myoclonic seizures. This causes sudden jerks or twitch of the arms and legs. Next is partial seizure. This affects only a part of the brain. There are two types. First is simple partial seizure. They don't cause loss of consciousness, but they might cause unusual sensation, movement, or emotion. Next is complex partial. They cause a change in consciousness. The person may seem dazed, perform repetitive movement, or exhibit strange behavior. They usually stare blankly, smack their lips, or fidgeting with their clothes. They also suddenly have a problem with communication. Next is how epilepsy can affect learning. Firstly, experience seizures during class. Seizures can disrupt the learning process. If seizures occur frequently or during critical learning moments, such as during exam or while studying, they can interfere with information retention and academic performance. Second is cognitive impairments. Epilepsy can lead to cognitive impairments, including difficulties with memory, attention, and processing speed. This cognitive challenge can make it harder for individuals with epilepsy to learn new information or retain what they have learned. Third is medication effects. Some anti-epileptic medication used to manage seizures can have side effects that impact cognitive function. This side effect may include drowsiness, fatigue, difficulty in concentrating, and mood changes, all of which can affect learning ability. Next is emotional impact. Person with epilepsy also can have emotional effects such as anxiety, depression, or low self-esteem, which can indirectly impact learning ability by affecting motivation, focus, and engagement in academic activities. Next is social challenge. They might experience social challenge due to stigma or misconception about the condition. They might face bullying and teasing. This social difficulty can create additional stressor that affect an individual ability to focus on learning. It's important for individuals with epilepsy to receive appropriate support and accommodation to address these challenges in educational settings. This may include access to special education services, counseling support, and communication with teachers to ensure a supportive learning environment. With the right support and management in place, many individuals with epilepsy can achieve academic success. Supporting individuals with epilepsy in their learning involves creating an inclusive and supportive environment that addresses their specific needs. Here are some ways to help epilepsy patients in learning. First, provide information and education. We should educate teachers, staff, and classmates, also peers about epilepsy to reduce stigma and promote understanding. This can help create a supportive and inclusive environment for the individual. Second, implement accommodations, which is work with the individual, their parents, or person that can address their specific needs. This accommodation may include extended time for assignment, preferential seating to minimize distraction, or having breaks during the school day to manage fatigue. So, third is create a safe environment. We should minimize potential risks by creating a safe learning environment. This may involve removing hazards such as sharp object or obstacle, and ensuring that there is a plan in place to respond to seizure if they occur. Another way is offer emotional support. Be supportive and understanding of the emotional challenge that individuals with epilepsy may face. Provide opportunity for them to express their feelings and concerns, and offer counseling or mental health support if needed. Lastly, promote healthy lifestyle. Encourage healthy lifestyle habits such as getting regular sleep, maintaining a balanced diet, and engaging in a regular physical activity. This lifestyle choice can help manage epilepsy and support overall well-being. By implementing these strategies and providing appropriate support, individuals with epilepsy can thrive academically and reach their full potential in learning and development. In these two last slides, I have provide the step for epilepsy first aid. The normal one, and another is for first aid if seizure happen if individual in a wheelchair. We have come to the end of the presentation. Thank you for your time to learning together. I hope we can help individuals with epilepsy to learning in better and comfortable environment so they can reach their full potential in learning and development. See you next time. Assalamualaikum.